Hello and welcome to today's exam practice screencast from the respiratory system. The focus is going to be on the mechanics of breathing. Now we're going to have a look at the different types of exam questions you could get, whether revising for an end of unit test, a mock exam, or the summer A-level exam with regard to the mechanics of breathing. Now the three separate areas we're going to have a look at: mechanics of breathing at rest, mechanics of breathing and exercise, and then we're going to have a look at the neural and chemical regulation of the mechanics of breathing during exercise. Okay, so that's what we're going to do, three slightly different angles on the mechanics of breathing. But before we go into these exam questions, let me just give you the basics, the absolute basics. This is not a screencast where you're being taught the intricacies of the mechanics of breathing. However, I think it would be silly not to start by saying there are certain structures that we have to have when we're talking about any mechanics of breathing questions. As we go through the exam practice screencast, we'll start to add the layers of stuff, or I will alert you to the layers of stuff you need to add in order to move up the difficulties of the higher tariff questions, I suppose. So if we go through from there then, what do we need to know with regard to the mechanics of breathing? So whether it's for inspiration or expiration, at rest or exercise, there are certain things that you cannot answer a mechanics of breathing question without. Okay, so what we have to know is that when you're talking about the mechanics of breathing, the mechanics to underpin our ability to breathe in and out, inspiration, expiration, are the following: respiratory muscles here, which are absolutely going to be huge, the rib movement, thoracic cavity volume, thoracic cavity pressure, and air. These are the five structures that will always be in your answer. Okay, so if we have a look down to here, we're talking about respiratory muscles, we're talking about the diaphragm and external intercostal muscles. Then we're talking about the ribs, thoracic cavity volume, thoracic cavity pressure, and the air, and whether it goes in or out of the lungs. So to put that in a little bit more context for you without giving you the answers, I suppose if you look at the mechanics of breathing, it all starts in terms of the process of inspiration or expiration, the breathing in of air or the breathing out of air. It all starts on the respiratory muscles, the diaphragm and the external intercostals, because these two muscles, you could say, are the cause part of the cause-effect relationship of the mechanics of breathing, because these two muscles contracting or relaxing, whether it's inspiration or expiration, will lead to the effect of the rib movement, the thoracic cavity volume increasing or decreasing, the thoracic cavity pressure increasing or decreasing, and whether air is going in or out of the lungs. So it's a cause-effect relationship. The cause of the contraction or relaxation of the respiratory muscles when we breathe in or out. Okay, so you cannot have a mechanics of breathing a response to questions in the exam without these things being in there. They are in every single response, so you have to make sure you get used to those. So in order to help you with that, what I'm going to do is, just before we go into the exam questions, I'm going to give you, you don't have to use this. If you feel you are really secure at this point, you've revised and you're happy with your subject knowledge, you don't need to use this. But for those who feel, bearing in mind I've just told you that you cannot have an exam answer to a question on mechanics of breathing without that key knowledge, then I'm going to give you a memory method that will allow you to connect or create a connection from the content qualifier, mechanics of breathing, and take that in to make sure we have a framework to answer effectively any questions on the mechanics of breathing. So let's have a look at what I mean by that. So if you get a question on mechanics of breathing at rest, I put rest there, it doesn't need to be rest, it could be exercise, and it could be neural regulation of mechanics of breathing. There are our foundation concepts we have to have in the response. So what I'm going to do is give you a way to move from the content qualifier, mechanics of breathing, into a connected acronym, and the acronym will then form the basis of the key terminology you will need to answer all exam questions effectively. So let's have a look what I mean then. So when we see the mechanics of breathing, if I said to you now, when you have breathing problems, do you go to a mechanic? Okay, and hopefully the majority of you would say no. Okay, a mechanic's for cars. Okay, so if we consider we have breathing problems, then we might consider, rather than going to the mechanic, we might go to the doctor. Okay, so rather than mechanic, we're going to go to the doctor, and then what I'm going to do, we're going to have a name for our doctor here. We're going to call our doctor Dr. VPA. Okay, that is going to be his name, and then we're going to translate that, and we're going to kind of connect it even more to make it fit for purpose, and we're going to call it, rather than Dr. VPA, we're going to shorten Doctor into the VPA. Okay, so we're going to call it the VPA. Now, once we have that, okay, so Doctor, take out the OCT and put the Dr. VPA goes to the VPA, and the reason we use that is because that will translate into our two top ones here, our two respiratory muscles, so the diaphragm and external intercostal muscles, our ribs, V, thoracic cavity volume, P, thoracic cavity pressure, and then air. Now, what I will just say to you on this, I am really keen on people using the correct terminology. So just because I have given you this acronym here does not mean you only have to write volume and pressure. You should be remembering and understanding that, you know, the area inside the ribs, okay, is the thoracic cavity. Okay, so we've got to make sure we talk about thoracic cavity volume and pressure. Okay, so hopefully you can see how that works. And you know that I've only just put one onto there. So that is how it would work. So that allows you to talk about that. Obviously, you have to then give the question context, okay, or your answer context. You know, so if it's inspiration, what happens to these two muscles? You don't just name them. You've got to give it context by saying, do they contract? Do they relax? What happens to the ribs? Do they move up and out, down and in? What happens to the thoracic cavity volume? Does it increase or does it decrease? Likewise with pressure. And does air move in or out of the lungs? So obviously that works across for both, but I've just put an example on there so you can see it. And I've done the same over there for expiration, and this is at rest. So you can just see that in action. Now that is just to get you warmed up. I have not given you any contextual information here, e.g. how to answer a question. I've just given you a framework by using a memory method. Okay, you don't have to use it if you feel like you know it already. That's absolutely fine. Okay, so let's get into some questions then. First section then, mechanics of breathing for inspiration and expiration during rest. Okay, so if we have a look onto here, type of question you might get, I'm going to model the first one as always, so I'll model what I would do using the acronym that I've just used there. Obviously you can ignore that if you don't want to use it, and then we'll have a go at you having an attempt after that. Okay, so mechanics of breathing, inspiration, rest, they are my three key things to highlight. That's my content qualifier, and this is the context with which the examiner is asking me to respond with. So let's have a look. So I need to now know, right, so I go from here, mechanics of breathing. So I'm going to go straight down to here because I like to use these things. So it's going to be a mechanic, no, not a mechanic, doctor, VPA, then we're down into there. Right, so then it's inspiration at rest. And now what I need you to have, and if I was answering this question, what I would look at is say, right, so my respiratory muscles, ribs, volume, pressure, air, I've got to now translate that into an answer that is going to allow me to get credit. So the question for this would be 4 marks. So let's have a look at how I could get those 4 marks. First thing then, so I would say the diaphragm and the external intercostal muscles contract. You can just use the word contract for both of them. So this causes... This is the cause. They are both contracted. It's active. Okay, so these two muscles contract, and when they contract, the effect is that the ribs move up and out. This creates an increased thoracic cavity volume, a space inside the thoracic cavity. So thoracic cavity volume increases. This will lead to a decreased thoracic cavity pressure, which causes air to rush in to the lungs. Okay, so that then gives me my answer for that. If you have a look over at the mark scheme, what would that look like? So it's got it onto here. So you can see here, so you've got external intercostal muscles contracts and the diaphragm contracts. Okay, so there's your first marks there, so D and E. And then this causes the ribs to move up and out. Really important, the yellow stuff there is making sure you have given it context and not just written down ribs. Okay, I'm sure you wouldn't do that. And then the thoracic cavity volume, okay, the thoracic volume, I use thoracic cavity volume, increases, causing a reduction in thoracic cavity pressure. Just put thoracic cavity, this is an old mark scheme, which causes air to move into the lungs. Okay, again, this is an old mark scheme, so just do what I put into red there. Okay, so that's that one. So that gives you a little practice on how you might work it. What I want you to do now, if that's me modelling a way you could use, could answer a mechanics of breathing question at rest, let's have a look at how it might work with mechanics of breathing at rest, but you're going to have a go now at looking at both parts, inspiration and expiration. So what I'm going to do now is put it on, Could I ask you to have a go at doing this yourself now? So if I just ask you at this point, could you pause if you feel ready to answer that? So pause it and see if you can have a go at doing it. Obviously what I've just done on the slide, let's see if you can do it yourself now, and have a go at answering both inspiration and expiration, and concentrate on your attention to detail here. Okay, so hopefully that is all right. Pause, go. I'm going to move on to the next slide now. Okay, so as you can see on here then, if you look at this, I'm not going to go through the first one because inspiration you just did, but I'm just going to talk to you about the expiration. As you can see, the acronym is down here, just showing how that would link. This time, during expiration, our external intercostals and the diaphragm relax, okay, and because they relax, that's the cause. When those two muscles relax, everything else is affected by that. So there's a downward and inward movement of the ribs. Okay, this decreases, it closes the thoracic cavity volume, which increases thoracic cavity pressure, which causes air to move out of the lungs because it wants to go where the pressure is low, high to low, which is in the lungs it's high, out, get out, breathe it out. Okay, so that's your section complete. Hopefully you can see how that will work. That is our section on mechanics of breathing at rest complete. Let's have a look then at how it might change when we look at mechanics of breathing for inspiration and expiration during exercise. Now when we see the word exercise in the respiratory system, it should alert us to something. Okay, and I always consider that the mechanics of breathing anything in respiratory. When we see exercise, we know we've got to alter, we've got to change our answer because our body changes when we exercise. Okay, so let's have a look at what we need to do. So when we see mechanics of breathing and exercise, we have to make sure we are looking at the key word here, exercise. Now I'm going to ask you to focus on the EX from exercise. So when you see that, I want you to remember two key things when we're talking about mechanics of breathing. Okay, we need to remember that we have to exaggerate and we have to add extra muscles to our acronym we've already got. So now we have the VPA, but because it's exercise, we have to add some extra muscles in to our respiratory muscles, and we also have to exaggerate what is taking place within our mechanics of breathing for inspiration and expiration. So let's have a look at kind of roughly what that means. So when it comes down to here, it means that when I'm talking about my two respiratory muscles here, I have to say they contract with more force. That is different to saying they contract, because now we're exercising, these two respiratory muscles contract with more force. On top of that, we have some extra muscles, okay, that come in, and skeletal muscles. So these extra muscles are attached to our skeleton in some place that cause, they just contract. Now, again, as we know, there is a cause and effect relationship. So what this means is if these contract with more force and we have some extra muscles contracting, this is going to have the effect of the ribs moving up and out further. We're exaggerating. It's going to cause the thoracic cavity volume to increase or decrease more. Okay, and then it's going to the same with thoracic cavity pressure, more, and this means that we're going to get more air, deeper breaths, increased rate of breathing, whatever, if it's inspiration or expiration. So hopefully you can see what that is. I put this in. These red things here are showing you that if you don't exaggerate the process, the mechanics that allow us to breathe when a question comes up on exercise, you are not going to be able to get marks. You will get 0 marks. So you have to show exaggeration, okay? And that's why I wanted to just show you how exercise can still use this acronym, but we've just got to remember to apply those two key things here to our responses. Okay, so let's have a look then. First question. So we've got describe the mechanics of breathing for inspiration during exercise. As always, I will model the first one. Okay, so if we have a look at this one, how would it go? So straight away, I'll put my thing down there. Der VPA, mechanics, no, doctor, der VPA. Now I've got to remember I put in my EX because I've got to do a couple of things on top. So what does that mean? Onto here, so I won't model that one. You can have a look at the answer for that one. So hopefully you've had a chance to have a go at that one, and maybe just go back if you haven't had a chance to practice that, and see if you can get your answer on. As you can see on here then, with regard to the mark scheme, Okay, so in this case, you can see that the diaphragm contracts with greater force, the external intercostal contract with greater force, extra muscles, the sternocleidomastoid and pectoralis major are used or contract. This causes the rib cage to move up and out further. Volume of thoracic cavity increases more. So you could just see there, it's pretty repetitive of what I said to you before. So that is how it would look with an answer like that. Now what I'm going to do is kind of show you what I consider, I suppose, the hardest question you can get when it comes to exercise, or the hardest one I've seen so far. Now, if you have a look at this one, so this question then, analyse the changes in the mechanics of breathing as exercise increases, which would enhance the performance of an endurance swimmer. Now, this now has got a few, I suppose, additional things for us to focus on. So when it talks about this one, it's talking about analysing the changes in the mechanics of breathing. So this is adding the words, rather than explain, it's analysing. Okay, so analyse the changes. So we have to now, I suppose, add a little bit of detail, and this is asking us, do we understand that these when we talk about mechanics of breathing, this isn't just 5 structures or 5 mechanics that allow us to breathe, they are interrelated. So we have to analyze the cause and effect relationship in order to be able to get marks for this. And of course, they've thrown in here the kind of scenario of an endurance swimmer. So we need to link something at the end to how this might increase performance with regard to the swimmer. Don't have to mention the swimmer directly, but it would help, I suppose. So let's have a look at what will be required for this then. So if I look at this, let's have a look at how you would go about it. I'm going to do how you should answer this for the inspiration section, and then what I want you to do is have a go at doing the expiration section. Okay, because it says mechanics of breathing, exercise, okay, and analyze. This means it hasn't told you inspiration, it hasn't told you expiration, so you have to do both. So we know that exercise equals exaggerate and extra muscles. Okay, so from there, that takes me down to my acronym, okay? But what I have to be really careful of here is the fact that I make sure that I can do the 2 causes, okay, and effect relationships. So I'm going to talk about how the top 2 muscles contracting with more force are going to have an effect on the bottom sections here, and then I'm going to talk about how the extra muscles contracting also have an effect on this. So that is how you have to go about this. So I'll show you how it would work. So how I would model this to start with, let's go for inspiration. Your job is to have a go at doing this on the next slide after. So for inspiration, I would start off by saying the diaphragm and external intercostal muscles contract with more force. Okay, then I would say the sternocleidomastoid or pectoralis minor or both contract. They are my 2 causes. Now, once I've got these 2 causes, I then have to talk about how these 2 affect everything else in the mechanics of breathing. And I think it's really important when it say analyze the changes that you show that. You say these contractions cause, okay, ribs to move up and out further, thoracic cavity volume to increase more, and thoracic cavity pressure to decrease more, which means there is more air rushing into the lungs. Okay, so you can see how I think it's really important that you have this kind of as related. Okay, this and this causes this. Okay, and because it's saying analyze the changes, it's important that you show there is a relationship between both of those. So if I leave that to there, I mean, I'm going to let you have a go at this on the next slide and try to have a go at both, see if you can remember what I've just done. But just to make you clear on this, I said at the start, okay, so if we can consider then the fact that the inspiration is active, expiration is active. That means the muscles are contracting. There is muscle contraction in some places. So if I said to you at this point, we need to just think, what does it mean then? If our inspiration is more effective and our expiration is more effective for the endurance swimmer? Well, it means that we get more air in, more air out. That means we get more O2 in during exercise, more CO2 out, which of course will increase our efficiency of gaseous exchange, which means the swimmer can I suppose perform for longer and more efficiently. So that's my help for you. What I'm going to ask you to do now is to have a go at doing this from memory. Okay, so could I ask you to pause the screencast now? Okay, and then we'll have a quick look at the mark scheme after that. Okay, so let's have a look onto here. So as you can see, I've put the key things here. Now I've done it in it. So if you look at this one, you did. I'm imagining you will have gone external intercostal muscles, diaphragm, contracting more force. Okay, you've also probably done it into here. Sternocleidomastoid, pectoralis minor, assist or contract. Those two will get you your first points. And then if you talked about that, then increasing the volume, thoracic cavity volume more, and you talked about it decreasing the pressure more and allowing more air to go in, you will have got yourself your 2 marks for inspiration. Okay, so I think it's better in terms of, I suppose, logically processing it to have our 2 respiratory muscles contracted with more force, our extra muscles contracted, and then talking about the effect that has on both of these sections. That will allow you to get your 2 marks. Okay, so you could also get the ribs here, it's, as you can see over there, and then down the bottom you can see on top of it. Now, interestingly here, it doesn't mention for expiration, I should have put a line there. For expiration, it doesn't mention the diaphragm and external intercostal muscles. And the reason that is because during exercise, the diaphragm and the external intercostal muscles during expiration, they just relax still. They can't relax more, they just relax. So they don't change. So that's why it isn't accepted in the mark scheme. Now, you could write it, just wouldn't get credit for it. All it wants you to do is to say that the internal intercostal muscles and the rectus abdominis or abdominis, they contract. Okay, now once you've said that, if you then link that to a reduced thoracic cavity volume, an increased thoracic cavity pressure, a further increase, which means more air is forced out of the lungs, that will get you your 4 marks. You'd already have your 4 marks for that. If you wanted to just add a little bit about this means that more air in, more air out, increased gaseous exchange efficiency, for example, that would be brilliant. Okay, so hopefully you can see how that was. That's the most complicated question you could get, I think. And if I move on to the last exam question screencast, let's have a look at this then. So the last thing to have a look at is the neural and mechanical regulation. Sorry, that should be neural and chemical. If you just want to just change that to neural and chemical regulation, the mechanics of breathing during exercise. Now, when we do this, when we see the neural regulation of the mechanics of breathing. Okay, chemical is just one of the receptors. So when you see neural, I'm assuming most people would think straight away neural equals receptors. So we have to know when I suppose the angle of the question in mechanics of breathing turns neural, it means we've got to know about receptors. Okay, so you might just use that. Now, in terms of memory, again, we've got our Doctor or der VPA, that can be down the side, that is nice and simple. But what it comes on top of that, I think when you see neural, it should ring some alarm bells thinking, right, this is different. Okay, so neural control of the mechanics of breathing means I have got to add layers on, not just exercise, not just exaggerate, I've got to do something more. It's urgent. So I might tell you now, rather than der VPA for mechanics of breathing, when it's neural, it's urgent, you might say, oh God, I need to ring der VPA. Okay, and the reason why you use that is because for your acronym, it will remind you that you have to talk about receptors detecting changes, increases in things during exercise. That information is sent to the respiratory control center, which then will stimulate the inspiratory control center, which then causes or stimulates 2 nerves to stimulate the diaphragm and the external intercostal muscle to contract with more force. So that is why you've got it on there. That will take you through. You still have your extra muscles because it's only really going to be used when we're talking about mechanics of breathing and exercise. But when we see neural, that is the content, that's the extra content qualifier that triggers a further layer of information. Okay, so the hardest question you can get in terms of terminology, but I think once you understand this idea of neural, it should be pretty much straightforward. I think the acronym is really handy here because it reminds you that you've got to go RCC, inspiratory center, and nerves. Okay, now not in the acronym, but hopefully people would understand. You breathe in, and then to breathe out, we don't have to do the whole thing, but we need to remember that for inspiration, there are 3 receptors, but for expiration there is 1 receptor that is responsible for sending that information to the expiratory control center, which then of course causes the expiration mechanics of breathing to take place. So that is that. Again, I did say this isn't a lesson screencast. This isn't a flipped, I suppose, health or flipped screencast. This is just an exam practice. So it's important that if you don't know this information, that you go back and have a look at the lesson screencast or revision screencast I've sent. Okay, so that's from there then. That's kind of what you'd look at. What we are looking then in the exam question: respiratory regulation or the neural control of the mechanics of breathing. What we are looking for, is it neural? You know it's going to be that because we just looked at it. Is it inspiration? Is it expiration? That's going to be our key. And then do we have the understanding to apply our knowledge to that? Okay, so if we move on from there then. Right, describe the neural mechanisms that regulate the mechanics of breathing for inspiration during exercise. Now, I'm hoping people feel they can have a decent go at doing that. Okay, so I've said there, neural mechanics of breathing, inspiration, exercise. You've got all the big words there. I mean, look at the amount of annotations. If you weren't switched on, that could cause you problems. So what should you be looking to do? I will put that there for you. I've even left that in by mistake for you. So if I said from here then, do you think you could have a go at answering that question now? Pause, see what you can do. Okay. Right, so let's have a look at how the answer could be. Now, what I've done is combined a few mark schemes because there has been nothing so far on the new specification for this. So how would it work? Let's have a look. I'll add them in now. So receptors. Okay, so first thing, we need to say the receptors and what they do. I've put 2 on here, okay, just to give you, I don't, in this kind of question, you wouldn't get credit for writing it all, like describing it all. So you can identify them all and then describe maybe what 1 or 2 of them detect. And then if you have a look from here, those receptors send the information to the respiratory control center. Okay, then we have this stimulates the inspiratory center down here. Okay, this then stimulates the nerves. Okay, so the phrenic nerve is responsible for stimulating the diaphragm to contract with more force, remember, because it's exercise. And then the intercostal nerve stimulates the external intercostals to contract with more force. And then there are extra muscles that contract: sternocleidomastoid, pectoralis minor. Now, when these contract, this then causes are exaggerated effects of the mechanics of breathing. So down into here, we've got to talk about this idea now, which is the rib cage moving up and out further, volume of thoracic cavity increasing further, decreasing further, and then increased depth of breathing, tidal volume, more air into the lungs from that. Okay, so hopefully people could see how that would work. Hope that's pretty extensive coverage of mechanics of breathing. You've had every single type of question you could get for that. Hopefully you feel like that is something you can work with. You can keep using a screencast. The idea is when you see a question, as soon as you see it, can you pause it and have a go at it? I think the idea being that you should, once you've done this screencast, then go to the exam practice books and have a go at seeing if you can do these without any hints, without any annotations. That is the aim. Could you do what's on here? Then check it and see if it's worked for you. Okay, thanks very much.